Hi, my name is Dr. Duncan, and I'm a family physician practicing here in Lake City at the Stewart Memorial Community Hospital and McCrary Roast Clinic. An annual wellness visit is a somewhat new term, and it's really designed to be an annual visit where your primary provider can review your health care and look at all the things that you might be needing, your individual risk factors. We look at preventative medicine, things such as cardiovascular screenings that you might be due for, cancer screenings that you might be due for, as well as preventative processes such as immunizations that you might be due for. They also at that time ask about some things like social habits that you might have that might need to be changed. So it definitely varies based on your age, and really what we do is we tailor that visit based on each individual's individual factors. One of the differences for the pediatric population is their wellness visits are oftentimes more frequent during the first couple years than it would be once they're older. And so specifically looking at that first 2 to 3 years of life, we're oftentimes seeing kids at 2 to 3 or 6 month intervals for that first couple years of life. Those are also wellness visits. They are a little bit different, tailored, looking at milestones for growth and development, but also looking at preventative health. Are they needing any sort of lab testing? Are they needing immunizations at that time? One of the common misnomers is that an annual wellness visit is an annual physical. The annual wellness visit does not necessarily include physical examination. Now, one might assume that it does, and ours oftentimes do include things, and what we individualize is, if a person's here for an annual wellness visit, is there any points of their health that would need to be examined at that time? I think it's a great time for people to come in once per year to at least go through everything with their provider. We can look at, has anything changed? Do you have any needs now that you didn't have a year ago when you were in? And are you not missing anything? And so a lot of people have the feeling like, well, I'm healthy, I don't really need to go in, I don't really want to have unnecessary expenses. But it's important to keep in mind that that annual wellness visit in almost all insurance plans, to my understanding, is covered with no copay or deductible. Having people come in at that sort of preventative stage actually helps their overall health in the long run, meaning if you do that annual wellness visit, they're finding things that you're due for, and we find that, and then we get it head on and get it taken care of before you get sick. You know, we'd like to encourage everyone to be sure that they get their annual wellness visits done once a year. Myself, as well as many of my partners here at the clinic, are all available and have openings at a variety of times for most people to get in. If you're a new patient wanting to come get your care established, we're happy to see you. Or if you're an existing patient that we haven't seen in a year or two and you're overdue, we'd love to have you come back in and get up to date on everything.
Choose excellence. Choose Stewart Memorial Community Hospital.